It's unregulated, so it can't be prescribed by a physician. And the doses are all over the map. Just because it says a certain dose on the package, whatever you get, doesn't mean that's the dose you're actually getting, nor does it mean that's the actual substance that you're getting. It does have some of these opioid-like properties, right? And so you are replacing the opioid for this opioid-like substance. And so it does go to these opioid receptors, and the receptors in withdrawal are looking for the opioid. And when they don't get the opioid in opioid withdrawal, then they get agitated, they get irritable, you go through withdrawal and you get very uncomfortable. So if you take a substance that's opioid-like, and it can go to those receptors and activate those receptors, then it dampens the withdrawal. The receptors say, oh, okay, we've got our opioid again. The challenge with that, though, is that then it replaces the opioids, right? It becomes something that then you have to withdraw from again. And so this kratom comes in, it replaces the opioid, and then at some date, you need to withdraw from the kratom. And the withdrawal from the kratom is largely like opioid withdrawal, as you would expect. A substance like kratom goes to those opioid receptors, and we have no research associated with what's the right amount, what are the risky amounts for individuals, what are some medications that might cross-react and make it more risky. We just don't have a full understanding of what those things might be. But we know it's a very potent substance, and it potently activates those receptors. And so there's just a lot of risk involved with a substance that is potent, but we don't know as much as we should about. Too much kratom can cause all the same issues that too much opium would cause. Decreased breathing all the way up to what we call respiratory suppression, which is the stopping of breathing. It can cause seizures, it can cause comas, dizziness, depression, all these kind of really negative effects that we see a lot in opioids, but we can also see this in kratom as well. We can see development of psychotic symptoms. We can see depression. We can see anxiety. All of these things have been reported with kratom. And as we try to understand this substance and we actually start to research it, it's actually been observed in the use of kratom as well by physicians as they've seen folks that have come in and utilized the substance. But it's never been really formalized in the way other medicines are formalized, and we really take a close look at what's going on with everybody that's ever used the substance. So it hasn't been formalized in that manner. And so I see much more risk associated with bringing this substance into an already vulnerable patient population that has gotten addicted to opioids, they're struggling with opioids, and they want to get off opioids, and then they introduce this new substance into their lives that can be very addictive, very problematic, and then they just end up developing worse issues than they had in the beginning.